Hey there, welcome to the stream home edition. I'm Josh Rushing, sitting in for Femi OK. Now look, if you're watching this on the YouTube live stream, I need your help. See that chat box over there? That's a live chat box. There's actually a stream producer in there right now waiting to get your comments and questions to me so I can get them to our experts that are in the show today. And it could not be a more important show. We're talking about family planning during COVID-19. I'm going to take you right to my computer to show you a table here. Now, it's not a pretty picture. Here we go, but it is an important picture. I want you to look right down here at this number, 6 months of lockdown. What happens if we're in 6 months of lockdown is this is the estimated number of women not able to use modern contraceptives, 47 million women. And now this is from about 114 low to mid income countries. 47 million women there will not be able to use modern contraceptives because of 6 months of lockdown. This is from the UNFPA. And why is that important? Because it could lead to an estimated, and this is the number over here in the column on the far right, 7 million unintended pregnancies. Now, let me add some more numbers to this. And again, this is from the UNFPA, that if the lockdown goes for 6 months, we can expect over the next 10 years, 31 million more cases of gender-based violence, 2 million more cases of female genital mutilation, and 13 million more cases of child marriage. Now, we've gotten in a lot of video comments from our community. We're going to go to those right now. Check this out.
Planning services in India has been affected by this pandemic and lockdown, and this limitation of services is because of lack of PPE for healthcare providers, fear of visiting health facilities, lack of supplies for contraception, closure of some of the NGO and non-profit clinics such as Mary Stops.
Supply chains continue to be disrupted, and the distribution is not what it used to be. And women and men understandably still have concerns about visiting pharmacies and healthcare providers to access their family planning. You take that compounded with the economic uncertainties, and we are concerned that there will be a lot of unintended pregnancies as a result.
We have seen women and adolescents unable to reach family planning services. We have seen safe abortion services suspended, considered not essential in these times of crisis. Yet we know from talking to women that these services are essential. So we need to work together as an international community now to make sure that we deliver these services to women. At Mary Stopes International, we've been trying to scale up access through telemedicine, by continuing our rural mobile outreach programme, and by working with governments to make sure that that family planning services are considered an integral part of the COVID response.
To discuss this, we're joined by the Executive Director of Family Planning 2020, Beth Schlachter. Beth, how are you today? Can you tell me first, what is Family Planning 2020? And then tell me why family planning is so important, especially during the pandemic.
Thank you so much for having us on today and for opening up this really critical topic. So first, FP 2020 is a global partnership that came together 8 years ago to put a focus on access to contraception as a priority development objective for countries, to help countries to meet their own goals for providing access to contraception. It's always challenging because access to contraception isn't just a service delivery issue, and we're seeing the disruptions of service delivery around the world right now because of COVID. But it's also, importantly, a social issue, a family issue, and a cultural issue. And so women face challenges in reaching access to contraception, even in the best of times, because even if supply chains are working and a range of contraceptives are available, they may face other restrictions to access that are because maybe families don't believe in access to contraception, maybe young girls aren't allowed to get those services, or there is a lot of pressure put on young women as well. So FP 2020 was put together to help everybody to solve these cultural and systemic challenges that have impeded access to contraception for women and girls around the world.
Thank you, Beth. And we're actually joined by two healthcare experts on the front line, a doctor from Zambia, Dr. Natasha Keoma. Did I pronounce that right, Natasha?
Yes, you did.
I did. And you're part of Copper Rose. Can you tell me about Copper Rose?
So, Copper Rose is a youth led organization that works to improve the lives of women and young people. And we do programming in sexual and reproductive health, we do programming in menstrual health management, economic empowerment programs, as well as leadership and mentorship. So, really, we're a group of young people that just want to thank our fellow young people in Zambia.
Speaking of young people, we're joined by Uluk in Kyrgyzstan, who's a peer-to-peer educator. Uluk, can one, you help me with your last name, and then two, tell me about the organization that you're with?
Hi, my name is Ulbatur Galiyev. So I'm from Kyrgyzstan, and my organization is Reproductive Health Alliance of Kyrgyzstan. So it's briefly, if I will tell about our vision. It's similar what Natasha and Dr. Natasha said, and we are also use like organization which provide like qualified information to young people, and not only about SRHR, comprehensive sexual education, and also family planning. We are protecting the basic sexual rights of the woman and girl and men.
So, Uluk, what were some of the challenges in doing that before COVID, and then how has COVID changed things?
Before the COVID, it was challenging with a cultural effect. It's a really shame to talk about the sexual and reproductive health and rights, and it's also challenging to advocate for the sexual education in schools. And before it was challenging because we couldn't have these conversations with many of other organizations, with many of other of people. But now it's still challenging because we couldn't access the young people from the rural areas, for example, as before, because the like lack of the internet connection or because of the lack of the safe place in their home.
Let's bring in a tweet from someone in our community here. This is Omar Farouk, who says, at this time, people need to have access to all the healthcare services. Our facilities are poorly financed. There's no better time for low, middle income countries to adopt performance based financing to solve the issue of financing and access to services. Natasha, what are some of the challenges that you face in getting out the message about family planning in Zambia, and how has COVID changed that?
The biggest challenge really is, first of all, Zambia is declared Christian nation, and so we usually get a lot of religious pushback because people want to use social and cultural norms to determine what decisions women make about their bodies. Well, there is a good enough, what can I say, penetration of family planning, but sometimes even young people or just any person is afraid to go because of the many misconceptions. So there is stigma around family planning services. In terms of COVID, I would say that what COVID has done is that it has reduced the penetration because, first of all, people are afraid of hospitals. So even if the hospitals are open and services are being provided, people are just afraid to go there because they're afraid they may get COVID or they might sit next to someone who's waiting to be attended to who has COVID. And so people are seeking these services a lot less. Also, there has been a deprioritization of things like family planning because healthcare providers are being taken to do screening and many other things. So what the authorities are doing is they're now being able to provide maybe 3 months supply so that people can reduce their visits to the facilities. But I think of all these things, the hardest thing and the biggest challenge is just how people are unable to access information because outreach activities have stopped completely. And we may think, let's go digital, but in a lot of the rural communities, we have to put in digital infrastructure even as we think of going digital.
Well, speaking of going digital, Natasha, I have a clip from a video that you guys put together. Can we check that out?
David wants to get rid of the baby, otherwise his uncle will kick him out. I don't know what to do, Malita.
Auntie Betty has the best concoction to get rid of that thing.
Don't call my baby a thing.
Fine, Mother Teresa, your baby. David won't marry you because you're pregnant. Just get rid of it.
Hi, girls. Suzio, could I speak to you for a moment?
Yes. Please don't tell my parents, Barita.
Suzio, don't be silly. Don't drink some concoction you know nothing about. Come to the clinic. We will discuss options such as keeping the baby, adoption, or termination.
Can I think about it?
Sure, you can.
Marita, I really appreciate it.
So Natasha, can you talk to me about the idea behind creating a video like that? And then what kind of response have you gotten?
The idea is to start to share more of this information on social media platforms, because a lot of people are online. Even though we can't reach the furthest people, we're trying to even reach the people that we have of the information. So that video talks about someone having an unplanned pregnancy and just talks through some of the options. But sometimes a lot of these discussions are very heavy in the sense that people are telling people what to do and what not to do. And so we thought animation is something which can relate to a young person and an older person, but also shares the options in a way that's has less jargon. And we've gotten a really good response, and a lot of people have been messaging us. And so we're using some of these tools to also refer people for services that they may need during a time such as this.
Well, look, we're getting some comments in our YouTube chat room here. Andy Jamio says, so true. I'm death scared to go into the hospital during this COVID season. So that's got to be one element that you have to deal with. People scared to access healthcare facilities because that's where COVID may be. We have another comment that says, well, if we're not careful, the side effects this virus causing could end up more damaging than the virus itself. All types of healthcare need to be easier to access at this time, not harder. There in Kyrgyzstan, Ulik, what are some of the things you're doing to help people get access to healthcare?
So we are working with young women and women supposed to give them access on these SRHR services in our country. But you know, it's still hard because due to the COVID-19 and we have really such a strong cases here in Kyrgyzstan, and all the doctors we qualified they go to the observations, they go to the red zones to work and to fight with the COVID, and that is why we have a lack of medical specialists on the places, on the rural areas. What we are doing now is to we are providing online consultations through the social media, for example, through Instagram. My organization personally had a clinics in gynecologist clinics, and our doctors from the beginning of the COVID start to help to with advice. Of course, in some cases we need some analysis and so on, but during this social economic crisis, not all the women get access for this analysis. And of course, we are working with the authorities, government, to not forget about the family planning issues, to not forget about the SRHR issues in this in this time. And this online consultations and work.
I want to come in on the back of that, Ulik, with another video from our community. This is from Michelle Lucott. She's a research fellow at the London School of Hygiene and Tropical Medicine in London. Here.
Access to family planning for refugees was already a challenge before the pandemic. Strict lockdowns and disrupted services have only made it harder. In Jordan, many primary health centers outside refugee camps closed during the lockdown, leaving women unable to access contraception. During this period, more than ever, family planning needs to be recognized as vital to women's health and well-being. Changes must be made to how services are delivered. It must become the norm to deliver socially distanced family planning services, to provide phone and video appointments, and to continue to provide families with information on contraception options despite the pandemic. Family planning is not an add-on, it's life-saving.
In our YouTube live chat, Liz, I want you to know I hear you. You say the video is fantastic, really great work. I want you to know if you go look up Copper Rose Zambia on Facebook, we just showed 40 seconds of a video that's like 2 or 3 minutes long, so you can check out the whole thing there. Beth, I want to bring you back into the conversation here. We're talking about Kyrgyzstan and Zambia with Natasha and Ulik, but this is really a global issue that touches just about every country in the world. Can you put this in a little bit of perspective for us? And I do have a comment that says, what's the long-term fallout of lack of access to contraception mean for women and girls?
Well, the long-term fallout is we're going to feel it at the individual level. Women and girls themselves are going to have more unintended pregnancies, which on a personal level means maybe girls won't be allowed to continue in school. For women who are having back-to-back pregnancies, they'll have less ability to recover physically, emotionally, and financially between pregnancies, which has an impact on their own health, as well as the health of infants and their families overall. So you can see a health impact that's at the family level, which then has an impact on the community level because you're less able to engage, less able to earn money, and at the country level as well, then these impacts continue to build. So when we're looking at access to contraception, it really has an impact on all levels of family and economy, both at the personal level again, and then at the country level. So what we're trying to do is ensure that supply chains continue to flow so that commodities themselves remain accessible. Uluk and Natasha talked about how difficult it is right now to continue to have access and to have access safely. But in many places, what we're seeing as well is that the commodities are no longer available, either because production has stopped at the factory level, international shipping has been disrupted, the ability to get commodities into a country and then delivered all the way out to rural communities. Every step has become more complicated because of COVID. So when you add all of that up, it means less access. And again, at that personal level, it means that women may not be able to manage their reproductive lives as they would have wanted to, especially for young people. And this is where Natasha and Uluk's stories are so important. That's where we're seeing really a lifetime impact if a young woman can't determine whether or not she can get pregnant or not.
You know, we have another video comment from our community. This is from Prashant Yadav. He is a senior fellow and professor in Washington, D.C.
Medicines get attention from global and local agencies, but contraceptives and reproductive health products are often neglected. And this creates risk that we may undermine decades of progress in improving the supply chains for contraceptives and reproductive health. We can solve this through concerted action by working closely across governments, by working with their cargo operators and manufacturers, sharing data in a better way, using clever analytics.
Mm-hmm.
You know, Beth, at the beginning of the show, I quoted some numbers from the UNFPA report that said that over the next 10 years, you can expect a fallout from just 6 months of lockdown. It said 31 million more cases of gender-based violence. I believe 2 or 3 million more female genital mutilation, and 13 million more cases of child marriage. How do those issues play into this? Why are they being impacted? And why does 6 months of lockdown turn into 10 years of impact?
Yeah, because families are going to solve situations in the near term. When you see economic crises, that's when you see this acceleration of activities that really are repressive toward girls in particular. That's what child marriage is all about. That's what FGM is about. It's about controlling girls and women. And in many cases, especially where there's a lot of poverty, the lives of girls are commoditized. Girls are sold through child brides, you see, and then that has a long-term lifetime impact. What we're seeing with regard to increased sexual assault and gender-based violence is also a result of the crisis. We already knew those numbers were astronomical and unacceptable. Again, the pressures on families, on communities, means that pressure is also often expressed through violence, and violence is often expressed through those who are the least able to protect themselves. And these have a long-term impact on the lives of girls, particularly where they're locked in with family members who may be their aggressors or their assailants themselves. I know that Natasha and Uluk are also seeing this play out in their communities. We're seeing a rise of gender-based violence in the United States as well. It's global. It's a global scourge and a global problem. I'd be interested to hear what Natasha's seeing in Zambia.
Thanks, Beth. I actually wanted to mention something. Just to bring a little bit of context to your question about how this is impacting girls. I'll give you a practical example. Most of the ceremonies that are in which FGM is done or child marriage, they are done during school holidays or when girls are not going to school. So what the lockdown has done is that people haven't gone to school in the last 3 or 4 months, and we don't know whether schools will open to the end of the year. So all those that were supposed to maybe go for FGM and they were going to school and that was an excuse. Now families have all the opportunity to disadvantage girls, and that's a tangible example of how the lockdown is impacting families.
Well, one little tiny bit of good news is that Liz in our YouTube chat right now just says she is sharing your video with all her friends on Facebook. Natasha, can you give me some stories of maybe solutions or hope? What keeps you going there?
What keeps me going is that every single time we go out to communities, we see that communities do want to help themselves. It's just that sometimes there are not enough people mobilizing. I was just speaking to my team today, and I just got this news that from some work that we did last week with some chiefs and traditional leaders, one whole village has come together to construct a youth-friendly space because they just learned the data of how many people got pregnant in the last couple of months. And so there is a lot of hope. People are willing to make changes in their communities. It's just that sometimes they need a little push, and that's what institutions like Cooper's are doing. And yeah, that gives me hope.
We have another comment from our YouTube audience here. Tet Yulin says, lack of confidentiality with telemedicine is a clear problem. Ooh, look, are you guys using much telemedicine there now to deal with the situation?
Unfortunately, in our country, we don't have telemedicine in SRHR and family planning. We are using social media only, like Instagram, Facebook, and other channels like Telegrams and so on in our region to get access to our audience. Because in telemedicine, it's also only about the COVID situation, how to protect themselves, but nothing about the family planning, how to get access on SRHR, and nothing about sexual education.
Well, let's speak of sexual education. We have an Instagram video that you put out. Can we check that out right now?
Ну, это стыдно, что идти к врачу и подозревать, что у тебя что-то не так.
This is in Russian, but they're talking about, as I understand it, access to abortion, right? Is that true?
Program on the myths and what is true and not true about the SRHR and family planning. And we have one a boy and one girl, and IMS expertise, they were have some conversation, and I was explaining is it true or not.
And Beth, we're about to wrap the show up here. Can you give us a sense of what people can do around the world who are concerned about this issue and want to help in some way?
It's a great question. You can continue to support the World Health Organization and the UN Population Fund because they have the lead globally to ensure access to contraception and sexual and reproductive health services more broadly, including in areas that were already in crisis. We had a colleague from the UK talk about refugee situations. Women and girls don't stop being pregnant. They don't stop having reproductive health needs in times of crisis, displacement, or as we've just learned, in time of a global pandemic. You can also learn more about what access to contraception actually means in the lives of women and girls around the world. As Ulik mentioned, there are a lot of myths, but there are also all of those social taboos that Natasha talked about earlier as well. If all of us as people are better educated about what access to contraception means, what do we mean by reproductive rights, what do we mean by the autonomy of women and girls, then we can help one another because we can take down that tone of negativity that sort of pervades sexual and reproductive health care for women everywhere. So I think as a global community, we can be more empathetic. We could learn a lot more about what this means, and we can contribute our resources and our time to those global efforts that are seeking to bring the same kind of services and openness to the lives of women everywhere.
Beth, thank you so much for being with us today. Ulik and Natasha, thank you to you as well. We'll be on the stream's Instagram Live with Natasha and I in about an hour to discuss this further. Thank you for being with us, and be safe and be well.